The $7.6 billion budget approved by lawmakers earlier this month marks the first time in several years that most agencies avoided seeing a cut in their funding. Among the agencies which received a boost is the State Department of Mental Health and Substance Abuse Services. While the additional money is a welcome change, it does not make up for years of cuts and falls short of providing needed mental health services to the majority of Oklahomans who need them.
The Oklahoma State Department of Mental Health and Substance Abuse Services has been on the receiving end of budget cuts the last few years, so word of a funding increase is welcome news. The agency's budget for fiscal year 2019 will climb by more than $11 million over the previous year's funding levels, an increase of nearly 3.5%.
In a time when most agencies were held flat, a few agencies saw an increase, and the fact that mental health and substance abuse was one of those agencies, I think shows that Oklahoma is beginning to make mental health and addiction treatment a priority.
Department of Mental Health Commissioner Terry White concedes the increased funding won't fully restore cuts from previous years.
It doesn't get us all the way there, but it's a great step this year, and we need the legislature and the governor next year to continue to close that gap so that we can restore the cuts that we've been made. But even more than that, we have to address the fact that only 1 out of every 3 people who needs help can get it in Oklahoma.
Nearly $4 million of the new money will go toward increasing employee pay and benefits, and about $2 million will be used to increase rates for providers of mental health services. The remaining $5 million will be used to expand criminal justice diversion programs, which provide alternatives to incarceration for those with mental health or addiction issues. White says most of that money will go toward offender screening in felony cases, which is currently used in 37 counties.
It's fully going to fund the offender screening, which is the actual evidence-based tool that is used to help determine if people need treatment and diversion or if what they really need is supervision or incarceration.
Another $1 million will be used to expand drug courts and mental health courts across the state.
We're grateful that we're making steps to expand those programs this year. It's really important we continue that progress in the future.
About 4,500 nonviolent offenders who would otherwise be in prison are enrolled in drug courts and mental health courts. Christina Edens is one of them.
I've been involved in the criminal justice system since the tender age of 19. Total, I served 8 calendar years under the Department of Corrections while incarcerated, and over 20 years of probation, and including fines and costs.
Edens actually served 2 separate terms in prison before enrolling in drug court.
Prison did more harm than good because I still have a failing relationship with my child, and he has a lot of mental health issues still from everything that's happened in his life, from me being gone. And
Dennis Sprouse is the special district judge presiding over the Sequoyah County Drug Court in eastern Oklahoma. Sprouse admits he was not originally a supporter of the drug court concept.
But after 12 years on the bench, I was in the midst of seeing more and more people come before me to be sent to prison, longer terms, only to come back worse than they went.
Sprouse says he's seen the value of drug courts in helping people to overcome their drug addictions rather than keeping them behind bars.
Part of what we do in drug court is begin to deal with them and begin to allow them to see themselves as they were created to be, and be able to reclaim those things that they seemingly have lost, and be able to go back and know that they can now retake their place in the community.
Eden says drug court provided her the structure she needed to get her life back on track.
Like a curfew, it eliminated all the people, places, and things that had helped in sending me to prison the first and second time. I couldn't be around those people, places, or things no more.
Cleveland County Judge Michael Tupper says when he began his career as a prosecutor, he believed in a tough-on-crime approach, which involved locking up drug offenders. But he realized over time that alternatives like drug and mental health courts offered a better strategy for overcoming addiction and managing mental illness, and the numbers have borne that out.
I've got to see firsthand over 600 people graduate. I've got to see over 150 drug-free babies born. I've got to see over 2,000 years of incarceration avoided. And I've got to see firsthand over $17 million in taxpayer savings just in our county.
Drug courts are currently operating in 73 of Oklahoma's 77 counties, and White would like to see that expand to the remaining 4 counties.
The struggle comes in with mental health courts. We only have mental health courts in 16 counties. It's time we get mental health courts in the other 61 counties in Oklahoma so that every Oklahoman who needs one has an opportunity.